Welcome to another Health Education episode with Dr. Lamo. Today, in this episode, I'll be talking about important health checks that everybody desiring good health should undergo from time to time. Now, a lot of time in our dailies, when we see obituaries, we see people saying after a very brief illness. But truly, most of those illnesses are not actually brief. A lot of people have underlying health conditions that have not been properly taken care of because regular health checks has not been part of our culture in this part of the world. And it is important that we need to turn a new leaf. We need to change to be able to enhance our health. Now, I'm going to talk firstly in this episode about 4 important things that we need to be checking regularly about our health, especially anybody 35 years and above and anybody younger who has any health challenge too. The first thing I'm going to talk about is our blood pressure check. A lot of people go around, they don't know what their blood pressure reading is. And a lot of time when we go on outreaches, we discover a lot of people are walking around with very high blood pressure readings, 200, 120, 180, 110, and they don't know. So it is advised, once you are 35 years and above, at least once in 3 months, check your blood pressure if it is normal. If it's abnormal, you have to check it more frequently. Those who are if you have family history, you have first degree relative like your father, mother, cousin who have high blood pressure, and by virtue of you being black and above 35 years, the risk of having high blood pressure is there. It doesn't automatically mean you will have it, but you should check your blood pressure to know, because when it is detected on time, you'll be able to treat it properly. Because blood pressure, high blood pressure is associated with stroke, with kidney problem, heart failure, heart attack, and a lot of other health conditions. But this can be prevented by regular check of your BP readings. And it's very easy to do that now. A lot of automatic BP measuring apparatus are available. You can buy and use in your home. So arising from today, go and buy a BP apparatus. Start checking your BP yourself at home. Check for your loved one, check your wife, husband, and relatives. And if it is above 140/90, go and see your doctor to be able to advise appropriately on what to do. The second important thing you need to be checking regularly is your blood sugar. A lot of people come around too, they don't know that their blood sugar is on the high side. And once your blood sugar is abnormally high, that's what we call diabetes. Diabetes is also associated with a lot of complications, kidney problem, it can increase the risk of stroke, can affect the heart too. But it is treatable and manageable, and it is better detected early. So once you are 35 years and above, or you have strong family history of people with diabetes, or you are obese, it is important, check your blood sugar. Once in 3 months if it is normal. If it is abnormal or close to being abnormal, you need to check it more frequently and do not be far from your doctor for proper checkup to prevent health complications. The third important thing is we need to be on the lookout to check for our weight. Being obese, having increased body weight is associated with a lot of health conditions like hypertension, diabetes, heart attack. So, and as a way you can know whether you're obese, you need to measure your weight, measure your height, divide the weight by your height in squared. That will give you, if you don't like mathematics, there are a lot of online ways. Don't measure your weight and height. Go online on Google. There are ways it will calculate your what we call your body mass index for you. If it is between 25 and 30, you are overweight. If it is above 30, you are obese. Ideal is between 18 to 25. So you need to know this on time so that you can take appropriate measure to lose weight and to prevent all these possible health complications like diabetes, high blood pressure, heart attack can be accompanying this. And lastly, in this episode, another important health check that we need to pay attention to, because it's also related to diabetes, high blood pressure, heart attack, is knowing the fat level in our blood, what we call lipid profile. Usually it is checked fasting in the morning before you eat. Everybody that are 35 years and above, anybody that's obese, anybody that have a strong family history of sudden death, heart attack, heart-related problem, you check your fasting lipid profile, the fat level in your blood regularly. If it is abnormal, see your doctor. Your doctor will know the right thing to do. These are some of the regular checks we need to be doing to prevent sudden health complication and sudden death. Thank you as you wait for more episode with Dr. Lamo.